Thanks, Kim. When surgery is needed, there's help from the neurosurgery department at Essentia Health. A surgical procedure is typically a last resort for treating serious back pain. Once again, here's Kim Kaiser.
As someone who spends a lot of time on his feet in the operating room, Essentia Health neurosurgeon Dr. Frederick Harris knows the importance of having a back that's in good shape.
Being able to stand up and move around limits everything that you can do. So when people have back pain, they're usually in excruciating pain. Their ability to function and do normal activities, even taking care of themselves, are limited by that pain. And I mean, I've had it before, and I can speak firsthand that back pain is a serious thing when you're having it.
But surgery isn't often the first choice for treatment.
The majority of patients with isolated back pain do not need surgery. Most of those patients need physical therapy and other forms of conservative treatment first. And the literature shows that most patients with that isolated problem will resolve without surgical intervention.
Of course, there are times when surgical intervention is the best option, like some patients dealing with lumbar stenosis, when nerves are compressed in the spinal column in the base of the back, or disc problems.
Probably the most common cause is a herniated disc, which can come from anything. It can be a degenerative process, it can come from a trauma.
Sometimes a vertebra in the lower back can shift out of alignment. When surgery is needed, procedures are enhanced by the latest technology in the operating room.
We got this stealth and O-arm navigation system about 2 years ago, and it's been a dramatic improvement in our ability to take care of patients with spinal injuries or patients that needed spinal fusions.
The O-arm provides images to the surgeon that help guide his instruments during the delicate procedure.
You have a CAT scan where you can then use instruments and tools and place screws and rods in with unbelievable accuracy. And that's been a world of improvement for our hospital. And there are only less than 100 of these in the country, I believe, and we're fortunate to have one.
Surgery often leads to an improvement of pain symptoms, but it can be a matter of time.
Time is relative to each patient. Some patients wake up and the pain is gone. Others, the pain tends to taper away. But they will notice that in most cases their ambulation is a lot better. They're more functional. They can do things they want to do. It just takes time to get to that point.
For Healthy Living, I'm Kim Kaiser.
Types of back surgery include spinal fusion, along with the partial removal of a disc or vertebra. When appropriate, Essentia Health does offer minimally invasive techniques with back surgeries. And coming up, if your back is feeling pretty good today, how do you keep it that way tomorrow? We'll have tips on keeping your back in good shape when we come back.